Influenza is a common sickness during the Indian monsoon, but this year, apart from chikungunya and dengue, health officials are also dealing with the swine flu resurgence. And with over 600 deaths in 6 months, diagnostic labs across the country say people are panicking.
Till about a month back, we were not getting any patient at all. But in the last 1 month, we've initially started by getting an occasional patient, then became a trickle. Now we are getting about requests for about 15 to 20 patients a day. So not to say that all are coming out to be positive, but that fear is in the minds of the patients.
The Indian government has said it is closely monitoring the influenza outbreak and has stepped up the supply of the swine flu drug Tamiflu at all licensed pharmacies. Before July, only government-approved pharmacies could stock and sell this drug. Physicians claim that the large number of deaths indicate a more virulent, undetected strain of the virus. They also say this year the system was caught unawares. Swine flu is more prevalent during the winters and after the monsoon.
So the truth is that diagnosis of these things are not all that easy. All the labs and all cannot pick up the strain so fast. It keeps on changing. The mutations keep on changing. So generally speaking, what happens is when there's a lull period, we don't harbor the thought that this patient could be swine flu. But when there is a spurt in these cases, then we start looking at every patient with suspicion.
What makes India most susceptible to a communicable disease is the sheer size of the population. With everyone moving in such close quarters at all times, all it will take is for one person to sneeze for the disease to spread. But there is a way out. Doctors say a regular flu vaccine can protect most people from swine flu, and it costs about $7 US. What's alarming for many about the H1N1 outbreak this year is that almost 40% of the deaths are among healthy people, those aged between 20 and 50 years. The immediate goal now is to contain the spread of the virus to ensure this doesn't become the pandemic of 2009 when over 1,000 people lost their lives. Neha Punya, CGTN, New Delhi.